Today our topic is the classifications of the moxibution and how to manipulate the moxibution. In clinic, we commonly use the moxibution with moxer to treat disease. It can be classified into 4 types, respectively the moxibution with moxer cone, moxibution with moxer stick, warming needle, and moxibution with moxer burner. And in details, the moxibution with moxer cone can be further divided into direct moxibution and indirect moxibution. They all have different indications and manipulation techniques. Today, we mainly talk about indirect moxibution and suspending moxibution, which belong to the moxibution with moxer stick. At the beginning, we should know what is moxer cone. Okay, the moxer cone is formed by shaping a small amount of moxer wall and then tightly into a cone. We have already talked about that. The moxer wall is made of by the mugwort leaves. It is also the raw materials of moxibution. Looks like this one. It is soft fibers and have special odor. And moxer cone may have different sizes according on the conditions to be treated. So here is a question: how to make a moxer cone? First time, we can place a small amount of moxer wall on your palm, and then use the thumb, index, and middle finger to knead and shape the moxer wall into a cone, like this one. If we put one moxer cone directly on the skin surface and then use lighter to ignite the moxer cone, this method is called direct moxibution. According to different retention time, the skin which apply for direct moxibution may lead to the scarring or non-scarring moxibution. For scarring one, it may leave the post-moxibution sore in the patient's body. This method which may cause the post-moxibution sore. It is good to treat some chronic disease, such as asthma. Okay, let us to learn the indirect moxibution. The indirect moxibution means we should put some specific materials between the skin surface and the moxer cone, such as ginger, garlic, salt, and aconite root cake. Since the similar manipulation methods, here we just explain the ginger acetate moxibution. Firstly, use a knife to cut a slice of fresh ginger. Then use a 3-edged needle or some sharpening tools to puncture several holes in the ginger. Next time, put a moxer cone on the hot ginger. Then move the moxer cone with the ginger to the skin. Ignite it. It commonly replaces 5 to 7 cones per point. Observing the skin become reddish without blister formation, you can stop the manipulating. This method is indicated for all kinds of cold patterns, especially for diseases such as vomiting, abdominal pain, diarrhea, B syndrome of wind cold type pattern. Next part, we will learn how to manipulate moxibution with moxer stick. There are 2 methods here, respectively suspending moxibution and pressing moxibution. At the beginning, we should realize what is moxer stick. Moxer stick is prepared by wrapping moxer wall with a piece of contact moral paper, and then shaping it into cylinder. Ignite one end of the moxer stick and point it at the point of the diseased area. We know that we could use moxie stick for two manipulation techniques, respectively suspending moxibution and pressing one. In this content, we mainly talk about how to manipulate the suspending moxibution. In details, we know that there are three techniques belong to suspending moxibution: warming moxibution, board picking moxibution, circling moxibution. Okay, let us study them one by one. For the warming moxibution, first time we should ignite one point of moxie stick and point it 2 to 3 cm away from the point or diseased area until the patient feels warmth but no scorching, just like this posture. Each acupoint can usually be heated for 10 to 15 minutes until the skin surface becomes reddish. In clinic, this method used to treat the chronic and deficient disease. Next method, circling moxibution. It means we should hold the ignited moxie stick, pointed a certain distance, and move the ignited end left and right, or on a circular motion. We usually use this method to treat pain and numbness arthritis. The last method have an interesting name called board picking moxibution. It means we should hold the ignited point and moving the ignited end upwards and downwards, as if picking like a bird. This method used to treat some acute disease and the disease of excess pain. Well, we have finished today's context. In this course, we learned how to perform some commonly used moxibution method in clinic and their indications. A question here: how to manipulate ginger-extruded moxibution? Thanks for listening.